Dr. Holland, why should I learn CPR and how to use an AED?
Well, Scott, the important thing to remember is that heart disease is still the #1 killer in the U.S., and that is for both men and women. So we still have a long way to go to improve the cardiac survival rate here in the United States. One of the things that has been shown by the American Heart Association is about 75 to 80% of all sudden cardiac arrests actually occur at home. And in fact, 95% of sudden cardiac arrests will die before ever reaching the hospital. So one of the things that's important to keep in mind is that brain death will actually start to occur, but if no intervention is done, between 4 to 6 minutes after someone experiences a sudden cardiac arrest. So if effective bystander CPR can be done and can be done early, the chances of the victim surviving essentially doubles. So learning and knowing CPR can ultimately mean the difference between life and death for someone. The other thing that's important to remember is that early defibrillation with an automatic external defibrillator ultimately is also very important. So for an individual to know how to use, to be able to get an AED, and know how to use an AED, which is very simple to use, can also make the difference in improving a person's chance of surviving. It buys time, essentially, until the paramedics or advanced care arrives.